Good evening, I'm Harry Keeling, and on behalf of Alaska Public Media and the Alaskan Aviation Safety Foundation, welcome to Hangar Flying. Our guest or Dr. Illig, I should say, has been our program recently, and she has been talking about a fascinating subject that's been in the news lately, at least of interest to us pilots, and that's sleep apnea. Dr. Illig, welcome back.
Thank you.
Let's pick it up where we left off. I think you were talking about treatment, or we were going to get in. Let's get into treatment.
Sure.
So if you diagnose it, what does that mean, and where do they go?
Well, it's helpful to figure out the cause of the sleep apnea. Like I mentioned before, it's an airway obstruction. In some individuals, it could be because they have a small mandible and maybe a dental appliance that can pull their mandible out would be the treatment. There are a small percentage of people who might have their problems alleviated with some surgical intervention. Maybe they have a really large, redundant, hanging down part or a big tongue or something like that. But most people are treated with a CPAP machine. CPAP stands for Continuous Positive Airway Pressure. It's a device that requires a well-sealing mask to be attached to a machine that puts out a little continuous back pressure so that at the end of their exhaling and when they're starting to inhale, things don't collapse shut like a valve. It keeps the airway open. And that's titrated to the individual's size and pressure needs. They're also very smart. They have little chips in them that can be used to monitor to see if the person's actually using their device. And that's part of what the FAA requires on an annual basis to make sure the individual's actually using it.
So do people have trouble getting used to wearing that?
Some people do, simply because of the claustrophobic feeling, but most people get over that very quickly. And for those people who need it a lot, they find it worth the effort, even for a few hours a night, because they feel so much better.
So these are small portable devices?
They've become smaller and smaller over time and less noisy, certainly not very romantic, but nonetheless, they put it on for a few hours a night and sleep better. Mm-hmm.
So could I summarize and maybe characterize this? It sounds to me like the requirement that the FAA has imposed is in a way self-disclosure.
Yes.
But it also sounds to me like that if a pilot has sleep apnea, they should answer the questions truthfully. Mm-hmm. And frankly, if they get treatment, they very well may be a whole lot happier and better off at the end of it.
They'll most likely be safer because they won't be as fatigued, and much of this chronic fatigue is unrecognized because that's normal to them. Mm-hmm. They don't realize how sleep deprived they are until they get good night's sleep. But it's also for their health. We know that the FAA really doesn't care about health, they just care about safety. But nonetheless, if you can reduce your risk of heart attack and stroke and things like atrial fibrillation because your organs, especially your heart, is getting oxygenated during the night like it's supposed to, it's not going through all of these cycles of hypoxia where tissues get damaged a little bit each time. They'll live longer and keep their medical certificate longer.
Well, I don't want to preach to the audience, but I think you've said it very well. And I would suggest, folks, if you have any of answer the questions truthfully and just and talk to your AME and talk to your doctor. This is the right thing to do, and you may thank Dr. Illig at the end of it for providing the very sound advice that she has. Petra, we've got just a little bit over a minute left, but I want to get into another topic, and I want to pique folks' curiosity, because you and I have had some very interesting discussions very recently about the Germanwings tragedy. And there's a couple of different areas I want to talk about, but you want to just start out and let's do this. Talk about your experience in a company medical program when you were, and
Right.
the fact that that's no longer the case.
Well, in the United States, the airline medical departments have been dwindling to almost zero. I think United is the only department that has physicians on salary anymore. Much is outsourced. It's very different than in many European and foreign countries where the airline actually has a significant component of the medical certification component of the pilot. Our country it just operates very, very differently.
Interesting.
Mm-hmm.
I'm going to cut it off there. Ladies and gentlemen, I think you're going to want to tune in next time. Dr. Illig has got some very, very well thought out or very thoughtful ideas. I think that we would all appreciate. And so tune in next time. Petra, thanks for being on the
You're
program.
very welcome.
Ladies and gentlemen, remember, we can only bring this to you through the Alaskan Aviation Safety Foundation, which is member supported. Go to our website, aasfonline.org, and renew your membership for 2015 if you haven't already. Until next time, fly safe.